morning to all. Hope I am audible. Thank you, Scientific Committee, for giving me the opportunity to present my free paper, Outcomes of Gonioscopy Assisted Translumina Trabeculotomy in Juvenile Open-Angle Glaucoma. So, juvenile open glaucoma is considered to be a subset of childhood glaucoma, presenting with very high IOP, and usually these patients present with very advanced glaucoma. So, both traditional filtering surgeries and GD have been seen to be working in these patients, but however, they have high failure rates, and of course, the complications are there. So, MIGs like these are GAT, these are subconjunctiva sparing procedures. So, they have been tested in all type of glaucoma. So, there is a limited study on their efficacy in GAT and GOAG, and there was no prospective study in Indian population. So, our study aimed to the safety and efficacy of GAT in patients with juvenile open-angle glaucoma, and the study design was prospective study, and the follow-up was for the 6 months. We included the patient with maximal medical therapy, with or those who could not tolerate the medications, patient who showed progression, target IOP was not achieved, and we divided our study population into two groups, the moderate ones less than 12 dB and more than 12 decibel, the severe ones. We excluded the patients with ocular trauma, ocular surgery, any corneal abnormality, and patients who were not anticoagulant therapy. So these are the steps of our surgery. As a routine GAT, we did a use of 5-chlorine suture. We blunted the tip. We did a 2 mm nasal goniotomy, and they introduced the suture in it. After 10 to 30 strokes, we retried it from the other end, and thus completing a 360-degree trabeculotomy. Outcome measures were intraocular pressure, anti-glaucoma medications, surgical success, complication, and best corrected visual acuity. So sample size was calculated 30 by the power 80%, and achieving expecting a IOP reduction of 40%. The success criteria was determined on two levels. The first level was 20% reduction and less than 21 mmHg without anti-glaucoma medication. Criteria 2 being 18 mmHg with 25% reduction without anti-glaucoma medication. Qualified success was this with a single AGM. So we had 26 patients, 11 in the moderate group and 19 in the advanced group. So if you see there was significant reduction in intraocular pressure in AGM from 23.43 mmHg to 40 mmHg and 2.93 anti-glaucoma medications to 0.8. And if we look at the IOP reduction percentage, it reduced at 38.6% at the week 1 and up till 30.9% at the end of 6 months. And if we look at patients who were on anti-glaucoma free medications, like a medication free group, they were 16, they were totally medication free at the end of 6 months, and less than one medication was like 5 patients, like 16.7 patients required. Total 70% patients in short were required for less than one medication. If we compared the two groups, the moderate and the advanced group, the outcomes were almost same. There was no significant difference between the two groups, and they had a good IOP reduction in both the groups. If you look at the success criteria, both the criteria 1 and criteria 2 had a good, at the end of 6 months, it was around 73.7% by using both the criteria 1, criteria 2 in either group 1 as well as group 2. So if you look at the complications, we had 1 or 2 patients with IOP spike. Microhyphema was seen in 6 patients, which resolved at the end of 1 week. Macrohyphema was seen in 1 patient, which required anterior chamber wash. So if we compare to our study with the previous done studies, we have some patients with, we had some studies showing GAT having 65.6% complete success, and others like with Q et al. Showed 58.6% reductions, and a bigger sample size of prospective study of 12 months showed 74.3. Ours being Indian population, a complete success coming to 70.7%. Coming on to the SWOT analysis of our study, the strength of our study was there was no previous studies in Indian eyes, comparison between the moderate and advanced GOAG, and weakness being short duration follow-up, small sample size. The opportunities can be, this can be an alternative to the traditional surgeries, and threat can be, yes, we have to think about the complications. So what was known before was surgical treatment of GOAG is particularly challenging, especially with traditional surgery, which has a poor success rate. GAT is effective in patients with juvenile glaucoma. There are few studies available.
Dr. Mayank, good.
What our study adds is that GAT is effective and safe in GOAG patients in Indian populations, and GAT is effective in both moderate and advanced GOAG with little minimal complications.